Hi everyone, this is Trisha Erpelding, the Director of Education and Advocacy at Mental Health America in Sheboygan County. And I wanted to take just a quick moment, a couple of minutes to talk about depression. We know that so many individuals right now are struggling with feelings of depression, and we want to just give a really brief overview of some of the signs and symptoms, things that people might be experiencing, and then provide a little bit of information on how you can get help if you are worried about yourself or someone that you care about. So, some of the common signs of depression that you might feel or that you might see in someone that you care about. Obviously, that the most common one that we think of are those signs of persistent sadness or hopelessness. You might also notice irritability, feeling really angry. Oftentimes for boys or men, depression shows itself as anger or irritability instead of some of those feelings of sadness or hopelessness. So that's one thing to keep in mind. You might also notice, some people have trouble concentrating, trouble remembering things, trouble focusing in the classroom or at work. You might also notice that people are a little bit more withdrawn or isolated. And this is something that a lot of people are struggling with right now, being more isolated because of the pandemic, not having as many social connections. People are really noticing that that's taking a toll on their mental health, or that, some of their friends or family might be struggling because they're not as connected. So, people who are depressed might also be even more isolated, less likely to reach out for some of that support or to engage in some of those kind of social activities. When someone is feeling some of those really, really deep feelings of depression, hopelessness, worthlessness, things like that, it may even lead to thoughts of suicide. And that is something that if you are worried about somebody or yourself having those thoughts of suicide, you definitely want to reach out to, a trusted adult, a trusted mental health professional as soon as possible. You might also notice someone who's struggling with depression may have trouble sleeping. We often think about people struggling with depression sleeping too much, that they have trouble getting out of bed, but often people can also have trouble with getting too little sleep, because when they, try to go to bed, those thoughts and feelings and overwhelming thoughts having to do with their depression kind of cloud their thinking, and it's not very easy to fall asleep when you've got thoughts like that going on. So those are just some of the signs that an individual might feel, or things that you might notice in somebody that you care about. We know that people who have depression are not alone. There are millions of people across the country who experience depression every year. Really, at any kind of given moment, there's about 17 million adults across the country who struggle with depression, and there's about 3 or 4 million kids, youth and young adults who struggle with depression as well. And when someone is struggling with depression, it really can look different depending on the person and the type of depression that they're facing. Often when we think about clinical depression, or someone who's kind of in that state of being depressed, oftentimes that is what we refer to as major depressive disorder. So having some of those signs and symptoms of depression, feeling sad, feeling hopeless for most days out of the past 2 weeks is typically what qualifies as a diagnosis of depression. There are things like bipolar disorder, which are periods of depression followed by periods of kind of hyper arousal or mania, we call it. So kind of that difficulty with sleeping, difficulty with getting tasks done, concentrating, things like that. There are people who struggle with postpartum depression, which is a type of depression that women can struggle with after giving birth to a baby. There are people who struggle with, all sorts of different kinds of depression. But the important thing to remember is that if you or someone you know is struggling with depression, there are treatment options available, and there is help out there. There's support out there. There is hope available to you. So if you are feeling like you are someone who might be struggling, or if you know someone who might be struggling, I encourage you to reach out. We are available at Mental Health America to support you in finding the right treatment and the right options that are available for you. You can look on our website, mhasheboygan.org. We have a therapist database and some different treatment providers and information available on our website 24 hours a day. You can also feel free to give us a call, 458-3951, and we will be happy to connect you with resources that might be appropriate. And treatment really looks different for everybody. Some people go to therapy, some people take medication, some people do a combination of both. There's art therapy available, and therapy where people are able to go horseback riding during their therapy session. So there are a lot of really unique treatments and a lot of ways that people can find help in a way that really fits what they need. But the important thing is just to remember, if you are worried about yourself or somebody else, to please reach out for help. Because we know at Mental Health America that there is hope for everybody out there who might be struggling with their mental health. So thank you so much for tuning in today. If you have any questions, don't hesitate to reach out. Thank you so much.